Austin decided to join the WIN program. We thought this was a great profile and a great idea to bring our teams together around a common goal, to focus on a key issue for us, which was musculoskeletal disorders for the perioperative teams, and really just to try a different approach to addressing problems. The value we see to taking an integrated approach is finding ideas that we would not have normally come across by involving parts of the business that we probably would never have even thought to ask. And for example, our human resource areas have a whole pile of information, things like the extent of sick leave and the impact that's having on the business costs, and potentially even providing us some data around why that might be, which gives us clues and opportunities that we would have missed otherwise.
Joy Foods had a number of experiences of injuries, mostly musculoskeletal, within the workforce, and we decided that the incidence was too high, we had to do something about it.
We have got a team of 6 that are on the WIN program. 3 are from production, 1 from supply chain, a couple of health and safety reps. It's really from their feedback and the feedback from staff that we've actually worked on these issues. One of the first change programs that we did was trying to make people more aware of incident reporting. We thought that if we encouraged them to do this and they weren't scared to do this, that in the long run it would cause us to actually reduce the lost time to injury.
Baseline data collection involves an employee survey and a worksite audit. At the end of each wave, worksites will also be asked to participate in a focus group, and that's really for us to find out stories about how their activities have been implemented and progressed whilst they've been participating in the program. So the benefits for worksites participating in the research evaluation project are they're able to access data about their worksite and benchmark against other participating worksites and use that in making decisions within the program and then also more broadly at an organisational level.
We've been able to gain some experience from other areas and some new innovations and insight that perhaps we wouldn't have had before by going out and hearing what industry and other health are doing to improve the wellness of their staff.
It brings together many members across the shop floor. It brings together outside resources which we didn't have access to before, and it brings together a solution program which we are finding is very valuable to actually resolve some of the safety issues which we're encountering.
We had a visit out to one of the other WIN participants, and we've actually picked up some really good ideas from them as well.
The WIN program creates a forum for us to pick up a greater range of responses to our safety issues.
The data which we have received back from Monash and from Melbourne Uni has been good. So our WIN team are actually breaking that down and actually still working on some of that data. But what we're looking at now is actually try to benchmark against best practice.
I think worksites are wanting to participate because they're able to access data about their organisation, their worksite and the particular workforce that they're engaging that they otherwise wouldn't be able to. One of the other benefits that we're hearing from worksites is that it's improving communication between management and employees.
We hope that we'll realise some efficiencies and some cost savings, but right now the big thing is that our staff are really, really excited that we are listening, we're paying attention to them, and we're working on making sure that we maintain their health and their safety.
With the WIN program, we're already seeing results. It has reduced the number of accident and reportable incidents, and last month we had no accidents reported.
It's a much more collaborative and structured approach than we've probably ever used in the past, with some great results coming out of it.
We have staff now who are looking after their safety. It's all about having a happy workforce that are confident to actually speak up if there is something that needs to be fixed. When you have a workforce that has good health and well-being, it actually runs into having an efficient operation as well.